means most of them doesn't require, 90% does, 95% doesn't require IVF. There's no indication for IVF.
Correct.
So that's the reason we don't prefer going for IVF. It's not that we don't do IVF. Patient won't, there's no indication for IVF.
Ma'am, you mentioned in passing that you do IUI, but you are not fully into IVF. So please tell us the advantages of doing IUI for patients.
So, what I mean to say, I am trained in, I have my fellowship in artificial reproductive techniques. So, I am trained to do IVF. Why I said I'm not doing IVF right now for this patient is, most of these patients, the problem doesn't lies with the female. The problem lies with the male, and that too, it's not in the sperm. The problem is they can't ejaculate it outside. So once we have to ejaculate them outside, just putting that into the female, IUI is the best choice. Why would I go for an IVF when I can ejaculate? Even if I have to go for IVF technique for sperm retrieval, I go till TESA, not TESA. If I do TESA, then I have to put the patient on OT, give them anesthesia, take the sperm out, and then I have to do ICSI. If I do ICSI, then the cost increases. Huge. So although the sperm is fine, most of the spinal cord patients, the sperm, if you check, most of them, first 2-3 months, because they are not normally self-ejaculating, the dead cells a lot. So we just need to purify it. Once we do a endo wash, or once we do a purification wash, sperm wash, then the IUI success. We have done few cases and they are successful only. So we are not, most of them doesn't require, 90% does, 95% doesn't require IVF. There's no indication for IVF.
Correct.
So that's the reason we don't prefer going for IVF. It's not that we don't do IVF. Patient won't, there's no indication for IVF.
It makes more sense for you to do IUI.
Yeah, and it reduces the cost also.
Exactly, ma'am.
We usually have because the basis of this trust is you have to provide quality service is lesser, low rates, cheaper rates. So unnecessarily telling them to go for IVF, they will cost in lakhs.
So in short, you are giving hope for patients who are wheelchair bound, who do not have other means, or only know more expensive means of getting pregnant. You're giving them hope. You're providing a livelihood for them.
Yes, we do that. Most of them, it's not about just like they don't have money. Even we have patients who are from well-known family and they have quite a good amount of money with them. But they also prefer IUI. No one wants to go for, see, if I have to do an IVF, I have to put the female on ovulation induction program, low injection, either any long protocol or short protocol, and she has to go in OT for ovum pickup, and again for embryo transfer, and the husband has to go to OT for TISA. So any operation, as a doctor, I know any procedure has this risk. That risk can be minor, that risk can be lifelong also. It can be life-threatening also. Anesthesia can be gone wrong, OT can go wrong at any time. So why I need to do an invasive procedure when I can do it non-invasively?
Exactly, ma'am.
That's always the protocol. Always go for non-invasive things first, then go for invasive things. So rather than putting the couple on treatment and increasing the cost, I can just take one couple just in simple index, because the girls are fine. The female counterpart is fine because they are not having regular intercourse. The problem lies there. So they are usually fine. You just give them an ovulation induction with clomiphene citrate or letrozole. They work very nicely. No problem in your follicles.
Right.
That's the way IUI is much.
Ma'am, I want to come back and question the services that you offer. In your website, I saw LCECU. What exactly is that?
That is low cost effective care. So low cost effective care, because we settled in small village, there is no major big hospital nearby. Around 40 kilometers, they are not much big village. So because our trust is registered and we have Clinical Establishment Act, we decided to give low cost effective care to the local villages. So we have fixed 2 days in a week where we provide local treatment, general treatment for diabetes, blood pressure, or whatever the village wants, village people. So they come, it's only we charge 50 rupees for them. And the medicine what they take, it's on 50% discount, most of them.
Okay.
So all chronic diseases of that village, we have adopted few village, we treat them. So that we call it low cost effective care. So that can range from a diabetic care to any acute cases, whatever they come.
And
this is a part of our research.
Okay. And ESU, RU, all those things are mentioned. I want to know what those are.
ECU, occupational complete, that is in education and counseling unit, ma'am. That's one of the things where we go and counsel the patient for, we have team which counsel them for chronic diseases. Now that includes disability, that includes non-disability also. Like, because we treat with brain injury patients and most of them are stroke, so we have a program of stroke prevention program. So we teach them why treatment of hypertension or BP control is necessary, what you should do, what you should not do, how will you prevent it, or if you are hypertensive, what are the danger signs. So this is a counseling team what we do. Every patient which comes with us, if we treat them with, we make sure one of our nursing staff goes and counsel her or him regarding now these are the ergonomic things you should follow. This is the thing you should daily take. This is how you should undergo testing once in a year or 6 months in a year, depending on this. That's a counseling unit.
Okay. So from what I can gather, while your main commitment is to rehabilitate spinal cord injury patients, you're also providing services to normal patients.
Yes, normal local patient who can't afford to go to big hospitals. We do palliative care also, because most of the brain injury or cancer patient and all that, when the family can't support them or they're unable to bear the ICU cost or something, we do palliative care for them also. That palliation actually, if you see, it's PCU also there. That is palliative care unit. So palliation we do. Palliation for either a spinal cord injury, palliation for a brain stroke injury, or palliation for a tumor patient or cancer patient. That also we do. The last stage, when the patient is not able, means when it's the stage 4, where the chemo and radiation or medication surgeries are not the way, then we also take them for palliation.
And I see that you also give geriatric care to necessary people.
Geriatric care, yes, that also. That's who my husband does that.
Okay, so that's a lot of challenge to carry onto people's shoulder.
So it's a small thing. We have a team, young team going as. So we do it. Our sisters, our staffs are. I'll say I'm really thankful to them. They stay with us in this small village and they take care of us and the patient. And we make a habit that we all eat together. That's one of the plans. The doctor, the staff, the patient's party, all we sit and eat in the same kitchen. All of us will wash our own plates. So we make a habit that they don't feel that they are in the hospital. It should feel that they are in a family. They have come here for treatment, counseling, be in the family, and then go back. And then we keep a follow-up of them also every 6 months, 3 months, how they are going on. So we don't want them to think that they have come to a hospital. It should be like they have come to another family.
Yes, follow-up is very important because many people and many places, they forget the patients.
No, we have a patient who was admitted with us. We have a WhatsApp group, so we keep on contacting them. Our protocol is we'll call once the day he went from here, the day he reached. So usually we'll call within 48 hours to ask how they have reached and how they have. Then from 1 month, then 3 months, then 6 months, and then 1 year. And 1 year we request them to come back again for one whole body checkup, because usually spinal cord injury or brain injury patient, they need to have yearly checkups. So we ask them to come back if they are not able, and we give them throughout this, we give them free teleconsultation. Any problem they have, they can call us and they can consult me or my husband regarding if they are having fever or any other things. So they whole lifelong we give them free of charge consultation fee for them.
Amazing. So basically you make lifelong connections and lifelong family members.
So that's what I'm saying. It's a family, bigger family. They come, they stay, they visit us as a family. So we always ask them to make sure that we are your family. So you have to come us and visit us once in a year. Tell us, even if actually we give them a few counseling sessions also, and then we ask them, even if you have gone back and you have faced some problem, you don't know how whom to talk, you can call us and talk with us. It's nothing that it should be with regarding your health.
Right.
But if you are sad, you can call us and you can talk with us. How are you? Why are you so sad? So we do that. We have a small chat with them. We'll ask them to send photos, what they are doing. We send them photos.
You're very involved in their lives even after they leave the hospital. That's great.
Yeah.
On a very selfish reason, I want to ask you, because I am from the Northeast and you said that this kind of care is not there in the Northeast. What are your plans of extending to the Northeast?
Right now, I won't see. I will I'll go a bit personal. I also don't belong to East. Means although I am a Bengali, but I was born and brought up in Central India. I was from Chhattisgarh, Bilaspur. And then I did my graduation from there, post graduation first in New Delhi and then in Calcutta Medical College, Kolkata. And my husband belongs from Maharashtra, although Bengali, but then he had his education from CMC Vellore. So he was in South. And he had this plan that he wanted to develop this rehab. So it was his guide, Dr. Suranjan Bhattacharya, who was the director that time in CMC Vellore, and he suggested us go towards somewhere there towards east or northeast. So we somehow we never planned to settle in Orissa. We were searching somewhere here, but the problem is my husband had an accident in 2013 when he came to visit his sister in Orissa, and then he had 3 months bed born, and then somehow we get because we have to stay that time here, so we developed here. So definitely. Right now we are beginning from here, but we do have patients coming us from northeast. We had Mr. Rinching from Arunachal Pradesh. He came and stayed here for 3 months. So if you ask me for extension, it's very too early for us because we have just started for 2 months, but we are open for all. We have our connections in northeast also. If you see, I'm not the right person to talk on this, but my husband do visit. I think Guwahati College because PMR department in Guwahati. That I'm not don't remember the name. So he goes, but any help you want from that side, we are always bound to we can take up. We take do pay case even if patient is don't have any money, then also we support him. And our services starts from the railway station or airport. The patient just has to reach the airport, Bhubaneswar or Puri. That is, and our team will be there to pick him or her from the railway station. And even while going back, we give the service that they reach till the train or airport.
That's a comprehensive service that you provide. Well, ma'am, you're not only giving another chance to wheelchair-bound people, but you are also giving them dignity. And on top of that, the rehabilitation that you do on infertility, that's phenomenal. And it's nice to see that it's nice to see you saying you're getting a lot of success rate because your patients don't really require IVF, but they require more of IUI. So it's commendable what you're doing. From Subhak Health Tech and my side, we wish you the very best in everything that you do. May the trust go on to achieve more and more, and may all your dreams and aspirations come true, ma'am.
Thank you, ma'am. Thank you so much. And I hope this Andro Wash can give more hopes, because what I had a talk with Rajat also and Sir also, Sohan Sir, maybe I'm maybe likely to extend once I start with this. Maybe I can use your Vivo that kit, insemination kit. I have to teach them a bit. So I'm myself. I'm not right now confident. I have to try it once or twice and teach them the female counterpart.
Yes.
Use them. So that's maybe it will take around 3 months for me to settle it down. We can forget that.
For the Androwash machine, I've personally interacted with doctors who purchased the machine, and they have great feedback for the machine. They're saying it's very successful.
Yeah, machine is definitely means I said na I was so surprised to form means I didn't knew. I just in one day in my Facebook book I got to, and most of my friends who are in big IVF centers, because we were colleagues, so they all are in big IVF centers. They were telling me though it won't work much. Why do you want to go for that? And I think see both are different. You are in cooperative hospital in IVF setup. You are sitting. I can't bear my husband just to increase, because see if I run it in a andrology lab, my cost increases a lot. I have to keep different consumables, that this and that. So I have a lots of things. This has definitely reduced my cost. Even I can reduce the cost of the patient, and it's portable. For me, it's very handy. I didn't knew India have this, because for electro ejaculator we don't have anything. I think I have wrote nearly 50 mails to all over world, every center asking me for electro ejaculator. Then Dr. Seeger, who is the patent from USA, he has that patentship with this. So he was, but the cost was so high. Even if I bring the machine to get it repaired, I have to again send it back to USA and then give it back. So it increases the cost a lot for the, because definitely trust has to run. So the cost part, because if the trust is investing so much in this, definitely there will be a pressure on us to gain that money back, right? To earn that money back. Although we don't work in that profession, it's like we never have this pressure of getting goals, like we have to have this much financial goal. We don't work on that, but then somewhere we have to look into cost things also. So that's why I was very interested in Enrowash, and after the demo and getting it, so I'm very happy with it.
Well, we
I
are
was having a chat with Rajat the next day that can you give me an electro ejaculator and sperm analyzer also. So he said that maybe we can do it in the future.
happy to assist you in fulfilling your dream. And we wait to hear your feedback on the machine and how you are impacting more patients.
So
Ma'am, it's
thank
a
you.
pleasure. Thank you so much.
Thank you so much, ma'am. Thanks a lot.
All right, bye-bye.
Bye bye, ma'am.